This presentation will describe type 2 diabetes, process and potential complications, and why nutrition is important in fighting this disease. Type 2 diabetes begins with the development of insulin resistance. Genetics and lifestyle does factor into insulin resistance, but data from the Nurses' Health Study suggests that 80% to 90% of the time obesity is the cause. Excess adipose tissue creates hormone-like substances that interfere with the signal insulin sends to the cells to stimulate glucose intake. If this continues without lifestyle changes, people will first develop prediabetes, and if left untreated, the person will eventually develop type 2 diabetes. According to the American Diabetes Association, more than 30% of American adults older than 20 have prediabetes. Having this disease puts a person at risk for neuropathy, ketoacidosis, kidney disease, high blood pressure, heart attack, and stroke. But weight loss and exercise can help prevent and manage type 2 diabetes. 3 lifestyle changes that can be made if a person is pre-diabetic or already has type 2 diabetes are exercise, maintain a healthy body weight, and eat a balanced diet. Exercise allows the muscles in the body to use glucose without insulin and makes insulin more efficient because insulin resistance goes down. Exercise also helps lower blood pressure and help with weight control. Eating a diet that is high in saturated fats causes weight gain and can lead to insulin resistance. So by replacing red and processed meats with lean meats helps lower saturated fat intake. Studies have found that eating high levels of certain foods can help with weight loss as well as raising levels of glucagon. One example comes from an article, Why Nutritionists Are Crazy About Nuts, published in the Harvard Women's Health Watch. It explains that eating nuts like almonds, cashews, walnuts can increase levels of glucagon like peptide 1. This hormone helps to control glucose levels and lowers insulin levels in people with diabetes. Nuts are high in polysaturated, monosaturated fats, and fiber that leaves the body feeling full for longer so that the body does not consume excessive amounts of food that can raise blood sugar levels. A person should, of course, avoid eating foods like candy, sodas, dairies, and too much fruit. These items, however, are not always the food that cause the largest spike in blood sugar levels. The food that causes the most significant spike in glucose levels are the carbohydrate group. Starches that quickly digest, like white bread and french fries, can quickly increase the blood glucose levels. When eating carbohydrates, a person should look for whole grains that are high in fiber, which is why a Mediterranean diet should be consumed. The Mediterranean diet is rich, heart-healthy fiber, nutrients, omega-3 fatty acids, antioxidants, fruits, vegetables, lean meats, and whole grains that can help lower blood pressure and risk of heart disease. Overall, glucose homeostasis has everything to do with foods a person eats. Not skipping meals helps blood sugar levels not drop, and eating meals high in fiber and low in saturated fats can keep glucose levels from becoming high and large amounts of insulin being released. So, for a person to start changing their lifestyle, family support is important, especially the family members living with the person who has the risk of or has type 2 diabetes. Once a patient has been diagnosed, making sure they know the reasons the diet should be followed needs to be explained. Explaining the foods that should and should not be eaten is the best start. Foods kept in the house should be foods that follow the diet plan. The truth is, diabetes can be caused by genetics, and if a family member has been diagnosed, then the diet and lifestyle changes could help the whole family in preventing type 2 diabetes. Family and friends can be a great source of support because they care about you, but they can't help you with the diabetes unless they understand it. Patients can help family members by telling them that they need help from them. Family needs to learn about how diabetes affects the patient's body, appointments and diabetes classes, and including them in new lifestyle choices and asking them for help is important. Websites like the American Diabetes Association is a great way for patients and family to begin understanding and to take action in fighting type 2 diabetes and to live a healthier lifestyle. Type 2 diabetes is a serious condition that leads to other diseases that can be fatal. Diet and exercise have proven to help prevent things like nerve damage, high blood pressure, heart attack, and stroke. Patients and family need to understand that not taking action and fighting against the disease, the quality of life of the person diagnosed will not be great and their lives will be shorter. In order to make sure a patient understands the disease and what needs to be done, I would have a patient write down what they currently eat and the amount of physical activity they do in a week. After explaining the disease and the changes that need to be made, I would have the patient write a journal about what they need to know about eating and the amount of physical activity they are doing. I would have them bring in the journal after a few weeks to me and go over the diet changes that need to be made, go over the diet changes that they have made that were healthy, and the things that they ate that may have not been the best choice, and go over alternatives for those foods. Nutrition is the most important thing when it comes to type 2 diabetes. By eating a healthy diet, patients can reach a healthy weight and choose foods that will not increase their blood sugar levels and reduce the risk of other diseases. Finally, patients need an advocate. The best way to advocate for a patient is to make sure they get the most up-to-date knowledge of their disease, help them educate their family about the disease, and make sure they know where to go and the best healthcare they need to treat type 2 diabetes.